again, welcome to this webinar on Nature for Health, particularly on phase 2 and on the expression of interest process. This webinar is really aimed at providing more information on what to expect in the coming months for those countries, regions, subnational entities that have submitted expressions of interest. So we're going to give you an overview of the process going forward, as well as an overview of, for those countries or regions that do get selected, an overview of what to expect. If selected, what would happen then? So I think without further ado, again, I will just say that for those who are joining now, if you have any questions, please put them in the Q&A button. But also please introduce yourselves in the chat by saying who you are and what country or region you're from. So let's move forward. This is the third set of webinars that we are organizing the expression of interest process for phase 2 of Nature for Health. We held 3 webinars. So we do webinars in English, French, and Spanish. We did some in November of 2024. To basically introduce the process and for the potential applicants. And then in February, we did during the window was open from January to April. And we did another set of webinars to basically, try to help those who were in the process of applying or thinking of applying to sort of help out with that process, with submitting the application. And as I said, this particular one that we're doing now is really for those who have applied and to sort of know what to expect. And of course, there will be opportunities for you to ask questions as well. So for all the webinars that we've already done and this set that we're starting today, we post the presentations and the recordings on the website and the link that you can see there on your screen. So, excuse me. If you have participated in previous webinars, you will have seen this slide. This is the timeline for the expression of interest process, which was announced at the CBD COP on the 24th of October of last year. We held those webinars in November. The actual window for submissions of expressions of interest was open on the 10th of January. We held those webinars in February for those who were applying or considering applying. And then the application window in principle was to close on the 24th of March, but although we had received quite a few applications already by then, but we decided to extend it by a couple of weeks, and so we closed it on the 7th of April to allow more countries and regions to apply. The process going forward after the 7th of April, there's a screening that is done by the Secretariat, and I will explain that in more detail. And then this webinars that we're starting today in May, and then there was going to be, and again, I'm going to explain this in quite a bit more detail. But over this month and next month, the eligible applications will be reviewed by the Technical Advisory Group of Nature for Health, and we expect that by August, the steering committee will be ready to make a decision on the selected countries. So let's have a look at those countries and regions that have applied. So this map shows you where the applications have been received from. And as you can see, they're quite well distributed around the world. The different colors here mean what, the lightest color is those countries that have submitted one application. In some cases, some countries have submitted more than one application. In some cases, there were duplicates. In other cases, there were distinct applications. But altogether, we've received 66 distinct expressions of interest. And yes, I was saying for 11 countries, there was more than one distinct application. So this map is showing you the applications or the expressions of interest that had a national scope, okay? Meaning that the plan was to work nationally if selected, okay? If we drill down into a bit of detail on this national scope, expressions of interest, and we look at the regional distribution in numbers, you see there probably the most applications have come in from Africa, also quite a few from South America, a couple from Central America, And then in Asia, there's also quite a few applications. We have from Central Asia, South Asia, and Southeast Asia. Okay. And then also we received 4 applications from Eastern European countries. So this is basically the same information that you saw in the map. But there were also a few applications that had a regional, sort of multinational scope, if you like, and others that had a subnational scope. So those we received, again, from all, with subnational scope, they came in from Central Asia, North America, South America, and West Africa, just 1 or 2 applications each. And we had 3 applications that had a regional, a multi-country scope. 2 came from Central American intergovernmental entities, and 1 came from the Pacific Islands. Okay, so that's a quick overview of the applications received. So as you can see, there's been quite a lot of interest, quite a lot of applications. And unfortunately, of course, we are only going to, in this process that I'm going to start explaining now, only up to 6 countries will be selected, countries or regions. So this slide gives you an indicative timeline of what the process will be going forward, okay, and for the selection process. And then what I'm going to do is to drill down for each of these into a bit more detail to explain what the process will be like. But so I'll just be very brief on this slide. In April, we already completed an eligibility assessment. That's to make sure that that the applications meet the requirements of Nature for Health, for example, that they have to be submitted by governments, that they need to have endorsement letters, at least from the Ministry of Health and the Ministry of the Environment, etc., etc. Then in this month and next month, as the Secretariat, we're conducting a more in-depth administrative review as well. And again, we'll explain that in more detail. And also in parallel, we are sending the eligible applications to our technical advisory group that basically review them on a technical level. In August, we expect the steering committee to complete based on recommendations from the TAG and the Secretariat to make the selection of those up to 6 countries. We will then notify the selected countries as well as those that were not selected. And then there will be a process for N4H partners to apply to be the partner or partners that will support the selected countries. Again, I will explain this in more detail. So then in October, the steering committee again makes the decision on which partners are going to be the supporters, the conveners for which countries or regions that are selected. And then around October or so, the partner together with the country partners would be developing a short scoping project document, and they will submit it to the N4H Secretariat. The Secretariat reviews it, might make requests for amendments, and once everything is clear, the Secretariat approves those scoping documents, and then the funds will be transferred to the N4H partner to start the scoping stage. And in the second part of this presentation, I'll be telling you a bit more about what the scoping stage should look like. Okay, and so we are expecting, this is in part to sort of try to, temper your expectations on how quickly or how slowly this is going to move. But we expect that, the actual scoping process for the selected countries is only likely to begin in January of next year. Okay. So going back to, again, through this list, but in a bit more detail, the first thing that we've already completed is the eligibility assessment. So as I said earlier, we extended the application deadline by 2 weeks from the 24th of March to the 7th of April, and that's when the window closed. And as you might, I'm sure all of you who've looked at the requirements, etc., and as I mentioned earlier as well, applicants have to be government entities from ODA, Overseas Development Assistance eligible countries, but of course they could be from a national level or subnational level, or indeed in regional intergovernmental entities could also submit. So NGOs were not eligible to submit expressions of interest. We did receive, I believe, 3 applications from NGOs, and those have been filtered out because they're not eligible. And of course, also those countries that were selected in phase 1 of Nature for Health were also not eligible to submit expressions of interest. So, and you will see what those countries were. I don't think we've received any from those that were phase one countries. So the uh, as I said earlier as well, each expression of interest had to be accompanied by these endorsements, ministerial endorsements from the Ministry of Health, from the Ministry of Environment or equivalent. We know the environment can be many different sectors or subsectors or sitting in different ministries. And then if the submitting ministry is not the Ministry of Health or the Ministry of Environment, we required an additional endorsement letter from that ministry as well. And then, of course, we always welcomed additional letters of support and endorsement and commitment, in fact, from other ministries that it's foreseen would be engaged in the project. So all those applications that have not met the eligibility requirements because they didn't have endorsement letters or because they came from an NGO are being notified that they're not being further considered, and that will happen this month. So the Secretariat will also in this month conduct an administrative review and to essentially look at various criteria that to show, to sort of look for demonstration that the government is really driving the expression of interest, the submission of the expression of interest, that there is a clear understanding on the part of the government of how the process works, which is part of what we're explaining in this webinar for the work of the convening partners of Nature for Health and other implementing partners. Also, a clear understanding of the Nature for Health funding rules, and in particular that the donor, which is Germany, which generally provided $50 million to establish and run Nature for Health. They do not allow us under their rules to pass any funding to government entities. Okay, so the way it works is that only Nature for Health partners, those that have that convening status, receive the funds and they administer those funds on behalf of the government and in service of the government. Okay, but of course that doesn't stop with the agreement of the governments involved for there being subcontracts being issued to either international intergovernmental organizations or NGOs, okay, to carry out specific activities. And we will also be looking, that the expression of interest as an overall fit within the mandate and objectives of Nature for Health. Okay, so in this process, if anything is unclear, we'll be reaching out to countries to clarify any questions that we may have. So as I said, in parallel, we are sending the eligible applications to our technical advisory group, and they will be reviewing them in the course of this month, but they will actually be meeting in June to sort of make final recommendations to the steering committee. They will be really looking at technical merits of the expressions of interest, considering things like commitment to the vision and objectives of Nature for Health, which is specifically upstream pandemic prevention by addressing ecosystem drivers and the integration of the environment into the One Health approach. They will also look at the threat levels to biodiversity and the risk of zoonotic disease spillover. And in particular, we are in Nature for Health currently focusing on zoonotic diseases of epidemic or pandemic potential. And so they'll be looking at those criteria in the proposed geographic area where the application is being submitted from. They will also be looking for commitment to the systemic approach that Nature for Health espouses to make it a multi-sectoral and multi-stakeholder process that includes, in particular, engagement with the local communities, particularly indigenous peoples and local communities. So that's what the tag will be looking at. And as I say, the tag will be making recommendations, which we will look at in a future slide, to the steering committee. And the steering committee in August will meet to look at those recommendations. Of course, they will look at the expressions of interest themselves, but also other recommendations of the tag and the Secretariat. And they will select up to 6 jurisdictions, 6 geographies to begin the scoping and implementation, or the development of the scoping project and implementation projects. And they will also look at a series of criteria, but a really important one for them is considering a geographical balance. Okay, so that there is not all the selected countries are in one region, but that there is a bit of a spread across the range of countries and regions that have submitted applications. So then in September, the Secretariat will announce the selected countries, and of course will individually reach out to those countries that were selected, as well as those that were not selected on the outcome of the steering committee decisions. Then a process begins to allocate the selected countries to convening partners. The N4H partners, again, if in case you are not familiar, but we have UNEP, the UN Environment Programme, UNDP, WHO, the World Organization for Animal Health, WOA, the International Union for Conservation of Nature. And those are the sort of 5, if you like, implementing partners, the ones that can be convening. The other N4H partners are the donor, Germany, as well as the Secretariat of the Convention on Biological Diversity that does not sort of implement projects on the ground. So what we will have is a process whereby those 5 partners that I mentioned will express their interest in convening the scoping process in the selected countries or regions. Each one will be allowed to express interest in up to 3 of the 6, and or the up to 6, and then those applications will be reviewed by the Secretariat, and again the steering committee will make a final decision on who convenes where. Okay, and that we expect will happen in October. Okay, so for those, once the partner and the countries are selected and the partners that are interested in convening in those countries are selected as well and matched, the development of a scoping project document begins. And that entails, we do have a template for scoping project documents that already provides a lot of the information that will be needed, but of course it also has to be completed. That is done by the selected government together with the assigned convening partners. Okay, so they will submit those scoping project documents, and we expect that to happen in the course of October or November. They will submit them to the Secretariat. The Secretariat reviews them. Again, there may be requests for amendments, but the Secretariat itself is the one that approves the scoping project documents. And then the funds are, we issue a funds transfer request once with the approved scoping project document, and the funds for scoping go to the selected N4H convening partner. Okay, and then the scoping phase, the scoping work begins. We expect it to last for 9 to 12 months, and the idea in those 9 to 12 months is to co-design the actual implementation project that will be carried out with a budget of about $2 million over 2 to 3 years. Okay, so I'm going to give you a bit of a flavor of what that scoping phase is supposed to look like, and I'm going to go in the second part of this presentation into a bit more detail on the tools and methods that we would use for that. But essentially, once again selected and the funds are in place, et cetera, the idea is for the Nature for Health partner and the country partners, the ministries, the government, to establish a small core team that is multi-sectoral, that basically serves like a steering committee of sorts for the scoping phase. The N4H partner will arrange to organize workshops and engagements with multiple stakeholders. Again, there will be a stakeholder mapping process, et cetera, and that is all done, by the core team. So the N4H partner is the one that does the execution, if you like, in terms of the administrative, booking the venues and organizing the travel, et cetera. But the stakeholder mapping and the sort of selection of venues, et cetera, it's all done together with the government. Okay, and in those workshops and engagements, of course, as I said earlier, it is really important for that Indigenous peoples, local communities are included in the design of the implementation project document. As I mentioned earlier as well, the budget for the scoping phase over those up to 12 months is $250,000. So that's what will fund the travel and the workshops, etc., as well as the convening partner would probably have to hire somebody to manage the process. So in the scoping phase, we would follow this systemic approach, which is what I'm going to explain afterwards, and to identify the specific problem or problems that are to be addressed in the intervention. And then there is a process to identify the solutions, the actual interventions or activities that will be done, and co-develop that project document, which is then submitted by the convening partner. It gets reviewed by the technical advisory group, and eventually revisions may have to be made, but it's eventually approved by the steering committee. So that brings us to the end of this first part of the presentation. So we would like to open the space now for questions. So if you could please type your questions in the chat, and then we will do our best to address them. If you prefer to speak, we are a very small group, so we can actually allow, I'm doing that right now. So I'm allowing the microphone for Joan Tato. Tato, welcome. So if you have any questions at this point, please ask. You can just unmute and speak, or you can type in the Q&A, whatever you prefer. And if you don't have any questions, let us know in the chat as well, if it has been so clear or so boring. No questions, I take it? Okay.
Nothing so far. Maybe just roll on and then we can circle back at the
Yeah,
end.
we'll do that, yes. Okay, so as I mentioned earlier, the main emphasis of Nature for Health is upstream prevention of spillover of zoonotic disease of pandemic potential. So what we'd like to show, if you participated in some of the previous webinars that we held, you might have seen this video already, but I'm going to play it again just to emphasize what we mean by upstream prevention or primary prevention. And for that, we have this short video by the chair of our technical advisory group. She's going to introduce herself, Katie Wollaston. But let me just play that, and then we can carry on.
Hi, I'm Katie Wollaston, biodiversity lawyer and educator from Queensland, Australia. I'm also chair of the Nature for Health Independent Technical Advisory Group, and I'm going to spend just a couple of minutes talking to you about the role of the environment and ecosystems in preventing pandemics. So much work has been done on human and animal health to curb the emergence of zoonotic diseases and spillover in the past. Unfortunately, though, not as much has been done on preserving nature to achieve health outcomes. That said, we know that the environment plays a key role in sustaining our health. People, animals, and plants depend on a healthy environment. Nature and natural capital is the source of health. We also know that zoonotic spillovers, particularly those of pandemic potential, are inextricably linked to the triple planetary crisis of climate change, biodiversity loss, and pollution. We currently focus on pandemics and disease, but if we truly embrace a One Health approach, we must include prevention of several other things, including the drivers of environmental deterioration that pollute our land, seas, and food sources. We need to preserve the biodiversity that underpins all life on Earth, and we need to shift our emphasis to prevention over preparedness and reaction and response, and be clear about what it is that we are preventing. Nature for Health advocates for preventative measures in line with the One Health high-level expert panel definition of primary prevention of zoonotic spillover. That OLEP definition states that prevention of pathogen spillover from animals to humans means shifting the infectious disease control paradigm from reactive to proactive. So prevention includes addressing the drivers of disease emergence, namely ecological, meteorological, and anthropogenic factors and activities that increase spillover risk in order to reduce the risk of human infection. This suggests that we need to work upstream so we can really reduce risk at the source rather than chasing the diseases as they emerge into animals and humans. We need to shift away from purely anthropogenic-centered focus on short-term human health outcomes and take a more preventative approach that improves the health of ecosystems, ultimately for the long-term benefit of human health. We need to tackle the root causes and strengthen human, animal, and ecosystem resilience and adaptation to shifting health risks. But how do we do this? Surveillance is important, response is important, and AMR is important, but relying on these after an outbreak means we are missing the whole upstream piece. Upstream prevention, though, means that we address the drivers of disease emergence at the ecosystem level, as the OLEP definition suggests. Any proposed measures, then, should start with an analysis of sufficient environmental laws and policies, as well as the research that relates to the specific environmental drivers of pandemics in your country. We need a change in mindset around how to prevent pandemics, and we need to collectively invest more in upstream prevention, which is rooted in the health of the environment, and link this to climate action, biodiversity conservation, and pollution and waste control. Now, there are several opportunities and entry points to help you with actions to achieve this, including the recently adopted CBD Global Action Plan on Biodiversity and Health. That action plan outlines many different types of upstream prevention policies, mechanisms, and actions. And we suggest that you consider whether some of them may be appropriate for your country's circumstances and your N4H application. Without preventative strategies that address the drivers and threats of spillover and disease from biodiversity to humans, and without tackling those at the ecosystem source, pandemics will become even more frequent and are likely to have increasingly disastrous impacts. N4H is about including the environment in your strategies, and that is where we all need to start.
Great. So,
Hi.
oh, sorry,
Kate.
I'm playing it again. Okay, so that was an explanation of primary prevention, which is one of the pillars of Nature for Health. Another one is grounded action, as you can see on this slide. A grounded action meaning it's working on the ground and actions and policies that are implemented on the ground. And the other thing is using a systemic approach. That's like the third pillar. And I just want to spend a little bit of time explaining a little bit by what we mean by a systemic approach. But before we go there, just a reminder, I've been explaining how, there'll be a process to develop through the scoping phase a project document. That project document needs to address the theory of change of Nature for Health, of which you can see a summary here. So again, the objective is to improve preventative policies and investments or actions in nature to reduce the risk of future pandemics and related health risks. That would be the sort of outcome that we are contributing, that the projects should be contributing to. But then the actual activities would have to fall into these and hopefully spread across these 4 buckets that you see here. The first one on the left is on enhancing evidence on the links, enhancing knowledge and evidence on the links between biodiversity, climate change and health to inform and improve decision making. The second one is about putting in place those preventative policies and actions that address those interlinkages and between biodiversity, climate change and health. The third one is about capacity building and improving knowledge management, advocacy and awareness on the links between biodiversity, climate change and health. And the fourth one is about governance. It's about strengthening One Health collaboration and governance structures, of course, including the environment sector as an equal partner in the One Health approach to, as Katie was saying in the video, to try to shift or expand the focus from the traditional, more reactive One Health approach of surveillance, detection, and response to put a strong focus on prevention, preventative action, and policy through the inclusion of biodiversity and climate change. So the projects, again, they will be developed together with you and your stakeholders, and they will be suited to your context and the specific problems that you want to address, related to, of course, the risk of pandemic emergence, right? And but they will have to be activities that fall within these 4 areas of work. Okay. So on the what I was saying about using a systemic approach, what do we mean by using a systemic approach? So the methodology that we are espousing and proposing in Nature for Health is something called soft systems thinking, and it really has three pillars, which is one of them, as in all forms of systems thinking, that you understand the interrelationships between the elements of the problem that you want to address. And the little diagram on the right here shows you, a little sort of spaghetti diagram of different factors involved in zoonotic spillover and how they relate to each other. So understanding those interrelationships is absolutely critical in order to be able to design interventions that will actually have an impact. But we all come from different perspectives, depending on whether we're a vet or a biologist or a medical doctor or a public health, et cetera, and we see things and we have priorities. We see things differently and we have different priorities. On the left here, you have the famous fable of the blind man and the elephant, people who were blinded and could not see, and they were taken to see an elephant and to touch different parts of it. And of course, each one of them had a different perspective on what it is that they were touching. That happens a lot in reality, that depending on our perspective, we see the world in one way or another. So engaging with the different perspectives, and hence the multi-sectoral and working together to sort of have discussions about the problems to be addressed, is super important to get a shared understanding, not just of the problem, but also of the different perspectives that come into it. And then it's also critical to reflect on boundaries. As you can see from the diagram on the right, everything here is related to everything else, one way or another. But yet, as I've described earlier, in the projects that Nature for Health funds, we're talking about $2 million over 2 to 3 years. You probably, definitely cannot address everything. So you have to make boundary decisions as to what it is that you're going to do, trying not to be over-ambitious, if you like, and trying to do everything, but try to find creative solutions that will have an impact and don't, extend beyond what is actually achievable. This approach is also summarized in this diagram, which is, I guess, a core diagram in our scoping guide, which you can access in the link that you see on the presentation, on the slide below. And this is a guide to doing the scoping phase for Nature for Health using this systemic approach. If you look at the blue snail, this is an iterative process. So you sort of go around and around, and you sort of start up, for example, by setting up that core team that I mentioned earlier, and you start engaging with those multiple perspectives and trying to understand the interrelationships of the elements of the problem that you've decided to address. But you all do that acting collectively. You make those boundary choices. You come up with creative solutions that are desirable and feasible. And in the whole process, you reflect and learn. So, and again, this applies to all of the steps in that blue, in getting started, in understanding the situation, in identifying those solutions and agreeing the actual implementation project. Okay, you take into account this 7 elements of that are in the inner part of the snail. So I would encourage you to have a look at this scoping guide. This presentation, of course, is going to be uploaded to our website. You'll be able to get the link there. But if you want to make a note of it now, it's natureforhealth.org/resources/scoping guide. And I think it would be useful for you to have a look at it, because the scoping guide was designed for the N4H scoping, but I think it can be applied in many different situations for the sort of wicked problems that we deal with in the interface between human health, animal health, and the health of the environment. So that's a quick overview of the of what to expect in the scoping phase and the systems approach in particular. And then just to finish up, we want to just remind you, for those of you who are not familiar with the phase 1 countries that were selected back in 2023, and so those are Ecuador, Ghana, Rwanda, Kenya, Mongolia, and Vietnam, and they're at different stages. Most of them are completing or have completed their scoping phase. But you can actually read a little bit about what's been going on in those countries, again, on our website. If you go to natureforhealth.org/phase1, and you can read stories about how the scoping process has been panning out in those countries, okay? So I think with that, this is the end of the presentation. So we will open up for questions again. And I'm going to stop sharing the screen, and if I can find the button. And thank you very much for your attention in this. And again, if you have any questions, please unmute and fire away to ask. Or if you prefer to type them in the Q&A, also feel free to do so.
Yep, just maybe I can add while you're thinking about your questions. It might take us a day or two to get the webinar recording up on the website, but it will be there. So I know, Anna, welcome to you. Joining a little bit late. If you want to see the beginning section of the webinar, we'll have it there, as well as the presentation slides. I think there's a question from...
Yeah, I think Tato has her hand up. So please, Tato, go ahead. If you unmute.
Yes, thank you very much. I hope you can hear me.
Yes, we can.
Okay. My name is Tato Mohabi from South Africa. I don't have any specific question per se. I know we missed the opportunity to submit our expression of interest. But I'm definitely just, learning a lot from the presentations in terms of, because we have a national process to develop our One Health framework. So this one is led by our Department of Health. But from the biodiversity, because I'm from the Department of Environment. So from the biodiversity point of view, we are taking the Global Plan of Action and the GBF, and to see how best we can integrate in terms of including in our national biodiversity strategies and action plans. And so I think just the presentations are very helpful, both in terms of how we can take the work forward, but also even maybe for the next phase of the N4H as well, because we were interested. It's just that I think there were some challenges in terms of putting forward an application or submission, an expression of interest. But so very informative presentations, and I think we would definitely like to reach out to UNEP for some guidance as well in terms of our national processes as well, outside of the Nature for Health for now. Yeah, thank you so much.
Fantastic. Well, thank you very much for that feedback, Tato. Indeed, we're sorry because we had some meetings previously with South Africa in the context of developing the National One Health Framework, and we were very much hoping that South Africa would submit. Sorry that you didn't. We very much hope that you will submit an expression of interest for the third phase, which we expect will probably be launched in 2027, and we will very much look forward to that. In the meantime, for sure, of course, reach out to us. I don't know whether you are going to be, Tato, in the workshop that is going to happen from the 19th to 23rd of May in Cape Town, but I will be there, at least for part of it. So if you're going to be there, this is in the context of MBSAPs, this UNEP run project on the MBSAPs under the GEF 8. And one of the elements that is going to be talked about there is biodiversity and health. Nature for Health, of course, was created before the biodiversity and health plan was finally approved, but it was inspired by it. And I think it is, for those who have applied and get selected, it will be an opportunity to also help develop and implement the Global Action Plan at a national level. So thank you very much for your interest again. And yes, really sorry that South Africa could not submit, but we look forward to your application in phase 3. Thank you. Any other, Joan, if you have any questions or comments? Okay, so I can see in the chat, Joan is asking, can you give examples of projects that target pollution prevention on air, water, and waste pollution? Are those included in the scope of Nature for Health? So I think that the idea of Nature for Health is, again, identify a problem. Of course, the problem has to be centered around, the risk of pandemics. There is evidence out there that the risk of infectious disease, there are a number of environmental drivers associated with it. They include things like habitat loss, habitat degradation, unsafe farming practices, but also include things like invasive species is another one, and indeed chemical pollution increases the risk of zoonotic spillover. Now, having said that, it's in the scoping process that you actually look within your context of what are those drivers that you think, based on your knowledge as well as on evidence from the scientific literature, what are the drivers that might be increasing the risk of zoonotic spillover of pandemic potential in your country. And if you identify locally, well, actually we think that water pollution or air pollution or waste management is an issue, it could be addressed, of course, in the scope of a project. But that, I mean, the whole thing about Nature for Health, we have these parameters about ecosystem addressing primary prevention ecosystem drivers, but you make it your own into your context. You think about those drivers and what it is that you can do to address them within an N4H project. So what I'm trying to say with this is we don't drive immediately to, oh, we're going to do a pollution project. You have the scoping phase to design it, and pollution may come into it, if that makes sense. Okay, any other questions, comments? Thank you, Joe. All right, well, if there are no more questions or comments, all that remains is to thank you for your participation. And we very much look forward to keeping you posted on the next steps of the process. And all the best for those who have applied with the selection. We'll certainly be in touch. Anything else, team, that we would like to add? No.
Thank you.
Or
Thank you for joining today, and we'll get things posted as we can. And you can check our website for further updates. There might well be upcoming information. If you haven't registered at the very bottom of our expression of interest page for our update list, you can click on and do that, and then we'll be sure that you are on the distribution list for notifications that come through. I think, Joan, is there one more question?
I think raise the hand, but in the end it was a thumbs up. But
okay.
Right.
Yep.
Okay. Thank you very much, everybody. All the best. And once again, thank you for your participation.
Have a good day. Bye-bye.
Bye.
Thank you. Bye.